Today we can see about iris diagnosis. So iris diagnosis is also called as iridology. Iridology is the study of iris, particularly by its color, markings and changes that is associated with disease. Father of iridology is Dr. Ignaz von Pexley. Modern father is Dr. Bernard Jensen. Anatomically, by seeing, iris is the forward continuation of choroid cord. It is a circular, mobile, colored curtain that is suspended in the aqueous humor behind the cornea and in front of the crystalline lens. In this picture, we can see the presence of iris. Next is the layers of iris. The iris consists of about 5 layers. The first layer is surface endothelium, stroma, smooth muscle fiber, basement layer, and pigment layer. So, next is the blood and nerve supply of the iris. The iris is supplied by long and short ciliary blood vessels, which forms a complete ring around the peripheral border of the iris. So, these nerve supply, the circular muscle fibers are supplied by short ciliary nerve. The other structures are supplied by long ciliary nerve. So, the zones of the iris. According to Dr. Bernard Junction, there are 7 zones in the iris. The first zone represents stomach, second zone represents the intestine, and the third zone represents organs like heart, bronchi, pancreas, adrenal gland, pituitary gland, pineal gland, and gallbladder. The fourth zone represents the organs like prostate, uterus, and skeletal system. Fifth zone represents brain, lungs, liver, spleen, kidney, and thyroid gland. Sixth zone represents muscles, motor nerves, lymphatic system, and circulatory system. The seventh zone represents the skin and the sensory nerves. Next is the analysis of iris. The iris is analyzed by its color and density. The normal color of the iris is light brown and light blue. It is different according to races and community. Next is the density. Normal density is the structures composing of stroma and surface layer of the iris that are normally developed and arranged in an orderly manner. In cases of defective density, these fibers are unevenly developed and arranged. Next is the lesions of the iris. There are two types of lesions, that is open lesion, closed lesion. First is the open lesion. The open lesion is open at one end instead of being totally circumscribed. It resembles as V shape or U shape. In the iris, the open portion of the lesion always faces the periphery. Next is the closed lesion. It is the other main type of lesion commonly seen in the iris. A closed lesion is circumscribed. It contains borders that are not broken. It is frequently almond in shape. In this picture, we can see both open and closed lesion. The open lesion is open at one end and it faces towards the periphery. In closed lesion, it is circumscribed and it looks like almond. Next is the markings in the iris. Several markings can be seen in the iris. First one is lymphatic rosary. It is also called as typhoid rosary. It looks like white flakes in the outer rim of the iris, resembling the beads of a rosary in or near the fifth and sixth zone. It is seen in cases of inflammation and enlarged condition of the lymph nodes and in case of typhoid fever. In this picture, we can see lymphatic rosary, that is, white flakes that are seen in the fifth and sixth zone of the iris. Next marking is the radii solaris. It is elongated and darkened lines that branch out like spokes of a wheel. It is indicated in cases of any parasitic infestation, toxic or slow bowel movement, etc. Next is the scuff ring. It is a solid black ring circling the iris at the periphery in the seventh zone. It is found in cases of any integuments in skin, hair, and nails, and an overactive and underactive elimination of the skin. That is, poor skin elimination may result in scuffing. Next is the cholesterol ring, which is also called a sodium ring. It looks like a solid white ring circling the iris at the periphery in the seventh zone. It is indicated in cases of any chemical imbalances in the body or excessive cholesterol and triglyceride level and hardening of arteries, and it is seen in cases of high blood pressure and decreased calcium metabolism. Next marking is the concentric nerve ring, which is also called a stress ring, which is looks like concentric circles and portions of arcs that are formed when the fibers are pinched or cramped. It is indicated in cases of any stress in the body, anxiety, or any physical irritation and mental disturbances. So, by seeing these changes in the iris, we can able to identify certain diseases in the body. However, research papers suggest that it may or may not be it may or may not be confirmed. Thank you.